A patient may come into the office to see me and say, I've got hemorrhoids. And I might say, well, so have I, because hemorrhoids are normal. It's not normal, however, for hemorrhoids to be symptomatic. But there are many other things in the area of the hemorrhoids that can be causing symptoms. For example, the commonest symptom of internal hemorrhoids is rectal bleeding. But other things can cause rectal bleeding as well, such as polyps and cancers, fissures, and we need to make sure that we have the right diagnosis. So a patient with symptoms coming from the anus needs what we call an anoscopy, which is an examination of the anus with a small metal scope, at which time other causes of the bleeding can be excluded and a diagnosis of hemorrhoids can be made. Then we need to diagnose the stage of the hemorrhoids. Hemorrhoids are staged according to their size and according to what they're doing. So, symptomatic hemorrhoids that are stage 1 are hemorrhoids that don't prolapse but bleed. So they've fallen down a little bit, not enough to enter the anal canal, but enough to be squeezed and rubbed by the stool and to cause some bleeding. Stage 2 hemorrhoids are hemorrhoids that prolapse into the anal canal, but go back to their normal position all by themselves when we finish having a bowel movement. Stage 3 hemorrhoids prolapse into and out of the anal canal, but don't go back by themselves. These are the ones that the patient has their bowel movement, they push the hemorrhoids out, and then the patient has to push the hemorrhoids back in with their finger. And stage 4 hemorrhoids come out of the anus, they prolapse out, and they can't be pushed back. They get swollen, they get painful, and if something's not done about them, they can get strangulated and they can die, and this is a medical emergency.